Hi, my name is Nicole, and I'll be your nurse today. Today I'm here just to perform some trach care. I know you're unable to talk right now with your trach, so I'm going to try my best to ask you yes or no questions. Just give me a thumbs up for a yes and a thumbs down for a no. Is your name Christine Chu? Right. Is your birthday November 11, 2000? Alright, now I'm just going to check your wristband. Okay, looks like everything checks out. I also noticed that you don't have an allergy wristband. Are there any allergies that I should be aware of? No? Okay, I also checked your vital signs earlier. It looks like everything's stable. And also, I noticed that you don't have any trouble breathing or shortness of breath. Can you confirm that? Alright, now I'm just going to listen to your lung sounds before we get started. Just give me a deep breath every time I put it on a new spot. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Alright, it sounds like you have some secretions in your lung today. So while we're doing some trach care, we're going to try to suction that out. It looks like the O2 stat is at 98%, so that's good. Are you experiencing any pain today? No? And then have you had this procedure done before? Yes. Okay, so just to tell you again, we're going to be suctioning out your secretions. We're also going to be cleaning and assessing the site, changing the inner cannula, your stabilizer, and the dressing. Do you have any questions or concerns for me? No? Okay, so now I'm just going to check my emergency bedside equipment. I have two trachs, one in the current size and one in the smaller one. I have an inner cannula, and I also have an ambu bag attached to 100% O2. So my suction is also attached to, and it's set at 120 continuous. Now I'm just going to check my supplies. I have my trach care kit, a new inner cannula, an extra pair of sterile gloves. I already have my mask and my facial on, so I don't need that. I have a sterile sheath catheter with the sterile disposable container inside, and I have sterile saline. Now I'm just going to do hand hygiene and put on new gloves so that I can set my workstation up. Next, I'm going to grab a wipe it down for at least 30 seconds to make sure that my table is fully saturated and dries for at least 2 minutes. Right, and I'll dispose of that. Once it's dried for at least 2 minutes and it's completely dry, I'm going to start transferring my materials over. Okay, now that everything's over, I'm going to get my gloves, dispose of that. Hand hygiene. I'm going to check that the door is closed for patient privacy, which it is, and I have my patient in semi-Fowler's position. And now I'm just going to prepare for suctioning by draping the towel over my patient. Start with hand hygiene. Now I'm going to put on a new pair of gloves. Okay, I'm going to open my catheter now. I'm going to make sure that I don't break sterility. Okay, I'm going to put this on and attach it to my suction. Okay, make sure that the wrapping is on and it doesn't touch anything so it still stays sterile. Okay, that's good. I'm going to hang that and let it not touch anything. The bag valve mask is already attached to 100% O2. I'm going to change into a new pair of gloves to get my sterile saline set up. Hand hygiene. Okay, another pair of gloves. I'm going to open my sterile container for my water and then dispose of this. Okay, I'm going to fill this up halfway with saline. Okay, and now I'm going to make sure that my suction works. My suction will be hanging over my patient's bed just because of environmental issues, but otherwise I would not be going over my patient. So now I'm going to make sure my suction works, making sure that the plastic wrapping doesn't touch anything else. Okay, the suction works. And then I'm going to hang it back, make sure that it doesn't touch anything. Now I'm going to hold the base plate down and remove the oxygen source. Okay, now I'm just going to hyperoxygenate my patient. Okay, the O2 sat is 98% and we're going to oxygenate, so we're going to hold for 6 seconds in between and then hold the breath for 3 seconds. And I'm going to do this 3 times. Okay, now that my patient is hyperoxygenated, I'm going to start suctioning. I'm just going to change gloves one more time just in case. Along with hand hygiene. Now I can get started and start suctioning. While I'm suctioning, I'm going to make sure that the plastic wrapping does not touch anything else to make sure that I still remain sterile. And I'm not going to suction for any longer than 10 seconds. Okay. I'm going to pull the wrapping back. And put this in and twist it while I'm doing it. Okay, now I'm twisting it. Once the patient started coughing, I'm going to pull out, making sure that my wrapping doesn't touch the cannula. Alright, and then now I'm just going to put it in more sterile saline. And then wrap that and hang that back on. Okay, so you were coughing. Are you doing okay? Okay, and are you feeling okay? That's good. So if I were to suction my patient again, I would give it 30 seconds before doing it again. There's no need for more hyperoxygenation. The patient's O2 sat is at 98%. And now I'm just going to replace the O2 source. And then remove my gloves and do hand hygiene. Alright, once I set my sterile disposable blocks aside, now I'm just going to do hand hygiene so that I can put on some gloves and set up my trach care kit before I change the inner cannula. I'm just going to put on some gloves. Okay. I'm going to open up my trach care kit. I already have sterile gloves, so I'm going to take the ones inside, put that aside. Next, I'm just going to take my sterile drape with a 1-inch border. Okay. I'm going to drape that over my patient. Next, I'm going to take my inner cannula, and then I'm just going to open it and then drop it in and then dispose of this. Okay, next I'm going to take my sterile water, carefully pour it in from the side, and set this aside. Now that my kit's set up, I'm just going to take off my gloves, dispose of it, and do hand hygiene. And get ready for the sterile gloves portion. And now I'm going to put on my sterile gloves. So I'm going to take the ones that I already have, wash it, throw this away. Okay, just going to put my hand in and fix the cup. And fix the cup of the other one. And then take this and throw it away, keeping my hands above the waist. Next, I'm going to take my Q-tips and just drop them into the sterile water. along with a gauze. And I'll drop it to the side like that. Okay, now I'm going to take my non-dominant hand and remove the O2 source. And then looking at your O2 sat, it looks like everything's still normal. Next, I'm going to use my dominant hand to replace or take out the inner cannula. I'm going to hold down the faceplate. My non-dominant hand is now clean, and I'm going to take this inner cannula. Careful not to touch anything, and then I'm going to dispose of it. I'm going to take the new inner cannula, and then make sure I don't touch anything. I'm going to insert it. Okay, and then clamp it in place. Okay, looking at your site, everything looks normal. There are no signs of infection. There's no redness, no swelling. So everything looks good. Now I'm going to put the O2 source back on. I'm going to check your O2 sats. Everything looks good. And now I'm just going to remove the old dressing. So I'm going to hold this in place and then take it out and then dispose of it. All right, now I'm just going to start cleaning the area. I'm going to remove the O2 source. I'm going to take my first Q-tip with the faceplate, and I'm going to clean underneath. Okay, going to dispose of that. I'm going to take another Q-tip and clean underneath. Okay, and I'm also going to dispose of that. Next, I'm going to clean the top while still holding down the faceplate. All right, dispose of that one. Last Q-tip. I'm going to clean the top right while holding down the faceplate. All right, how are you feeling? Can you give me a thumbs up if you're feeling okay? All right, good. I'm going to take my wet gauze and I'm going to clean the faceplate with it. All right. Put it all around. Clean out all the dried out secretions. And I'm going to dispose of that. Next, I'm going to take the dry gauze. I'm going to pat it dry. Pat the faceplate dry. Okay, and I'm going to dispose of that. Okay, now I'm going to put on the new dressing. I'm going to try my best to take it underneath. I'm going to lift the faceplate up a little bit. Okay, and I'm going to slide it under. Tuck it underneath. Stabilizing the faceplate. Okay, and wrap it around. Okay, make sure that it's secure. Next, I'm going to put the O2 source back on. And then I'm going to take off my gloves. I'm going to do hand hygiene. Okay, so just wanted to check up on you. How is that? Are you feeling okay? All right, that sounds good. Okay, so now I'm going to be changing your necktie, and then to put on a new stabilizer, I'm going to ask for assistance while I'm changing out or pulling it out and putting it in. My assistant will be holding down the faceplate, and then I will be holding down the faceplate when they're changing it on their side. So I'm going to do hand hygiene. My assistant and I are going to do hand hygiene. We're also going to put on gloves. Okay, now I'm going to take the O2 source, put it here. Looking at your O2 sats, everything looks good. Everything looks normal. I'm going to have my new stabilizer ready right here, and then my assistant's going to help me hold down the faceplate while I remove my side. Okay, and I'm just going to slip this out. Okay, and I'm going to help them hold down the faceplate. gonna tuck that back in. So looking at the site, there's no signs of redness or infection, and there are also no pressure ulcers on the neck. So I'm gonna slip this out now from underneath the neck, and I'm gonna dispose of that, and then put on the new stabilizer. So I'm just going to slip this, raise your neck, and put it underneath. Okay. I'm going to slip this while they hold down the faceplate. Okay. Make sure it's not too tight. Okay. Gonna put on the faceplate. Okay, and does that feel comfortable? Okay, that's good. I'm gonna slip 2 fingers underneath. All right, that's good. I'm able to slip 2 fingers, and then 2 fingers underneath. Okay, that looks good. Right, and are you feeling okay? Okay, that sounds good. Now I'm just gonna replace the O2 source, and I'm going to dispose of everything I no longer need. This, my trach kit that I no longer need. I'm going to dispose that in the correct receptacle, and then my sterile saline, I'm going to throw all of that away in appropriate bins. Okay, now I'm just going to take off my gloves and do hand hygiene. You can also throw away the sterile gloves in the appropriate bin. So just to check up on you, are you feeling okay? All right, I'm actually going to put on a new set of gloves. And throw the sterile drape away into the appropriate bin again. And now I'm going to fold up this towel and put it in the clothing bin. And now I'll take off my gloves and do hand hygiene again. Okay. Hey, now I'm going to make sure that all my emergency equipment is here again. I have the 2 trachs, one in the current size and one in a smaller size, the inner cannula and the ambu bag attached to 100% O2, along with the clean suction catheter, and just in case of an emergency. Now I'm just going to assess your vital signs. Looks like everything is stable. And are you breathing okay? All right, that sounds good. No shortness of breath? No? Okay, sounds like you're doing a lot better. Now I'm just going to listen to your lung sounds. First, I'm going to take off this towel before I take listen to your lung sounds. I'm going to throw this in the appropriate bin. I'm going to do hand hygiene again. All right, just take a deep breath like last time every time I put it on a new spot for me. Deep breath, deep breath, deep breath, deep breath, deep breath, and the last deep breath. So listening to your lung sounds, it sounds like you don't have any secretions. It sounds a lot more clear. The O2 stat is at a 98%, so that is good. Are you experiencing any pain right now? No? And do you feel like you've tolerated that procedure well? All right, you did. Do you have any questions for me about it? Okay, nope. So I'm gonna make sure the environment is safe, your surroundings are safe. Call bell is within reach, bed at lowest height, 2 to 3 side rails up. And when I'm gonna document the date and the time of the procedure, that the patient tolerated the procedure well. The assessment of my site, I found that there was no redness, no swelling, no signs of infection, and no pressure sores on the neck. I'm gonna document when we changed the stabilizers. I'm also gonna document the color, amount, consistency of the sputum that we suctioned out. I will also document the vital signs in the O2 stat before, during, and after the procedure. Okay, I'm gonna do hand hygiene again. All right, just use a call bell and let me know if you need anything. Thank you so much, Christine.